Um, Thank you, everyone, for attending, and for this is a great attendance for our webinars. I just want to, again, and I say this multiple times over and over again, express my gratitude to the Mental Health Foundation. And we are really lucky to have such wonderful advocacy for mental health. And they do such incredible work for so many decades now. So I am very honoured and privileged to get an opportunity to have a conversation with you guys today. As Jim mentioned, my passion is about helping young people, and our passion is about building a more resilient future for young people, and building a more hopeful world for children by teaching and educating parents and carers about children's development, as well as how certain things might impact a child's emotional development, and what they can do to support that. As you guys have all lived through with me, and all of us have lived through the pandemic, and you've all heard about all the concerns about increasing mental health issues or anxiety in children over the last couple of years. And along with that comes the difficulties of gaining help and getting support for young people. So there's not very many clinicians or psychologists or therapists who, one, are willing to see children, and two, who have vacancies or spots to see children. So one of the things that we've done with our team at Relational Minds is to thought, okay, what if we try and help parents to learn some therapeutic skills, and then that becomes this phrase that we come up with called parenting for mental health, or therapeutic parenting. Now, this is really important because, one, like we said, it's hard to access support for children, and two, even when you see a psychologist once a week, the time that you have in that hour is kind of quite limited, and there's a lot of research that shows that the recovery for the young person actually occurs in the time between appointments rather than within that hour. So it becomes even more crucial to have parents and carers who understand your emotional development and understand how you can interact with your children. So what we're going to do today is I'm going to present some information to you, starting off with a basic biological understanding of emotional development, and then maybe start to move into how our relationships with our parents and our attachments can interact with that. Please feel free to post any questions on the chat line, and we have a moderator here that's going to help me to keep an eye on those questions. And if there are questions that come up, I'll try and answer them as we go. This is a topic that can potentially go on for quite a long time. So let's dive right in. So what I'm going to do is share my screen. Okay, so what we're gonna do first is to think about the brain and arousal. Okay, so and this is really a very, very, very basic understanding of brains and emotional systems, and I think this is core understanding that all people who look after children should know and should have, because it really is crucial to learning and adapting how we interact with children. So let's start with this image here of the brain. That's the front of the brain, the back of the brain, the bottom and the top. And one of the things we'll say first is that we are mammals, first of all, and then just like all mammals, the core of our brain is made up by these organs that are in charge of managing safety. right, and survival. And one of the ways we manage that is through emotions. So emotions that lead us to fight, flight, and freeze, they're all our survival techniques. And that is the reason why our species continues to flourish. So therefore, these emotional systems are the core of what makes us mammals, and they are there from the beginning, and they are there that they predominate a lot of our function, even through our adulthood. And when we are born as babies, most of those systems are already formed. And in fact, what then has to happen later on is we need to develop the other parts, and so that we get a lot of cortical growth, so the growth of our cortex. And essentially, what happens after the development of regulatory mechanisms that help us to work with that emotional system to function in our world. And let's focus primarily on our frontal lobe, so that in our frontal lobe, what exists are in the deeper sections of our frontal lobe. We think that this, among other parts, the anterior cingulate cortex needs to send fibers and networks to connect to that emotional system to regulate anxiety and other mood issues, so sadness, anger, worry. The other thing that a very important part of our frontal lobe is the dorsal lateral prefrontal cortex, which is what is in charge of executive function. So attention, focus, planning, impulse control, strategizing, right? So you can see how both of these systems together create this frontal lobe that's really crucial to our decision-making, our personality, and also regulating those emotional systems, right? So the development of our brain through childhood goes from the bottom up and from the back forward. So what that tells us is that these systems, particularly the executive functioning systems, actually happen later. So what that means is that at certain ages of development, we don't expect someone to be able to pay attention and focus and make difficult decisions and strategize until much later on in their life. And that's really, really crucial as carers, because we need to know where the appropriate developmental age is of our child. Now, so we need to adjust our expectations based on their appropriate brain development, because otherwise, we will be asking too much of them. There are then certain things that happen, or certain factors that will affect the speed of development of these regulation systems. One of those is genetics. So which is something we may not necessarily particularly understand too well, but there's something in the lines or family trees that we have where we might notice a number of people through the generations whose emotional systems are much harder to find, aren't very well regulated by these other executive systems. And so what does that mean? Does that mean that there are areas on the frontal lobe that maybe don't develop so well because of genetics, or maybe it relates to the efficiency or the quality of the networks or the fibers that need to connect to these other brain systems? And we don't really know for sure, but we might think it might be a little bit of both. And then when we think about conditions like autism, one of the things that we find about autism, we don't know everything yet, but there's lots of things that we do know. And one of the things that we know about autism is that the way their brains connect together, they seem to be better at developing networks that are local. So the closer brain cells tend to connect well together, but being able to connect long distance from the front to the back or from the left to the right, those networks seem to be less efficient or less formed, which kind of makes sense. So then you've got young people who, when you ask them to do one task and it's a defined task, they might do that pretty well, but then you might add a distractor or add a second task or a little bit of stress, then suddenly that their brain might not manage that task so well. Or even more problematically, sometimes that brain can become overwhelmed and then regress in its function to that basic mammalian emotional fight, flight, freeze response. So in other words, children who might be a little bit more developed, and I'll also qualify that this also includes adults who are actually fully developed, sometimes will regress back to that more primitive way of functioning in their brain. So lots of adults, when they get stressed enough, or another good way to simulate it is you drink enough alcohol and you switch off your regulation or inhibition systems and you come back to acting like a toddler. And so therefore, the way we support that brain is also like we would support a toddler. So we wouldn't expect them to have full understanding of planning and nuances, and they might not even be able to soothe themselves, so we need to help them soothe. Okay, now there are some pretty, pretty basic concepts, but really crucial. Now, let's add, and again, feel free to, if anyone has any questions, then please feel free to send that through in the Q&A section. Let's now talk about what happens when we add stress to the equation. So, which then brings us to this other image here, and this is an image that's been adapted and brought over from Stephen Porges' work. And what this shows is that as our stress levels increase, we can move into different phases or stages of this emotional response, where when our stress levels are low, we can be engaging, and Stephen Porges talks about social engagement system that's able to be present, and we can be grounded, and we can be curious, and we can be open to influence and be mindful. But then as we start to increase, we can move towards our fight, flight, freeze responses, and ultimately, if we get stressed enough, we go into this dissociative phase where our brain really starts to lose control. We start to lose touch with reality. We start to not even be there anymore. And what happens when you look at a brain, and this was stuff that Bessa Van der Kolk has been talking about for quite a while, is that when they did these studies of veterans with PTSD, and they reread their trauma stories to them, and what they showed was that as their panic attacks and arousal start to increase, you kind of cross a certain threshold where the frontal lobe that it was working will even switch off. So that's a really, really crucial finding, because that explains why adults, and especially more commonly children that we look after, start to look like much younger children, because these regulatory systems have switched off by the time they reach certain levels of arousal. So it's basic, but it's really, really core. And the other things to point out here is that this area, which is Broca's area, also disappears, and that's one of the areas that's in charge of expressive speech. So that's crucial to know, because those who have teenagers will see that the more stressed our teenagers become, their words start to get less. You might get shrugs, or you might get told to some sort of expletive, because they're no longer able to reflect on the situation, and let alone being able to express their thoughts. And the other thing is this system, there's a real bugger about this system, because it's not so much that you get stressed and then your brain, your regulation part of your brain, your frontal lobe switches off. And then when your stress levels come down, it's not quite as simple as switching back on and going, oh, I'm back. Unfortunately, there seems to be a process where you end up with a lot of shame and shutdown and hopelessness that comes with it. So if only it was a matter of coming back online so easily, but it doesn't seem to be. And what I think goes on is it's these repeated times where our young people dysregulate, lose control of their emotional systems, and then have these repeated periods of shame and hopelessness that actually leads to problems like depression, because then it's those systems that then keep popping up in their brain. So Daniel Siegel talks about, neurons that fire together, wire together. So the parts of your brain that get used, they kind of get reinforced. So if these are the systems that are constantly firing for you, then that is going to be something that's going to cause a problem, because that's going to be networks in your brain that are going to be much more reinforced. All right. So that essentially is, the core basics of the brain wiring and the blueprint of how we regulate our emotions. Now we get to think about what are the things that affect that development, okay? Because you can see that you can then see that the speed, the rate of development of that is going to be affected by lots of things, and we, when we talk about that part of the brain that works well is going to be the thing that gets reinforced. So if you have trauma in your life, and so those of you who aren't aware of the phrase adverse childhood experiences, I really encourage you to go and look that up. That's a very, very well researched area that talks about that the more areas or the more adverse childhood events a child experiences, the worse their outcomes are. And this isn't just talking about emotional outcomes. This is talking about, outcomes in terms of finances or outcomes in terms of education, outcomes in terms of the burden to the community in terms of their health. One of the questions that come up here is about whether the Broca's area is affected in selective mutism. There isn't a clear study that shows that someone's Broca's area is under functioning in someone with selective mutism. That hasn't been done, but I think we can assume that will definitely affect Broca's area, because Broca's area is one of the ways that we can communicate. Having said that, it's not just about speech through voice. There are Broca's area is also engaged when you communicate by writing, for example. So that might not necessarily be the only area that's affected. Selective mutism is a difficult area that we don't fully understand, but we think that it's related to that relates to that freeze response that to some degree that person or the young person is able to control, because then they choose not to engage, not because they're being difficult, but because they are assuming that it's going to be a difficult interaction for them. All right. Now, what are some things that can affect our development? All right, so I want to share my screen again. Kim Golding, so Relational Minds, we build our service on the practice of dyadic developmental psychotherapy. It's a model invented by Daniel Hughes, and then there's been a number of people who've really progressed those thoughts, which is about, which is a model that talks about how the relationships that we have, or what we call the intersubjective experiences that we have, affects our brain development, but can also help our brain development. So so Kim Golding, one of Dan's proteges, talked about made a list of these factors that can affect a child's emotional development. Now, it doesn't, all of us might, especially those who work in the out-of-home care space or child protection system, we might think, oh, well, obviously trauma, sexual abuse or physical abuse. But a lot of the young people that we see don't have that history, right? They don't see, we say, well, has anything happened? And a lot of them say, no, that hasn't happened. I haven't been sexually abused or haven't been physically abused. And so when we think about it, that there are actually lots more subtle things that can affect a child's emotional development. Now, what is that? What are some of those? So one is early physical difficulties. So even things like illnesses or complications of a pregnancy. Sometimes these complications include exposure to substance use or infections through the pregnancy or soon after birth. All of these areas can affect brain development. Another one that's quite subtle is children who are born prematurely. Now, there's lots of reasons why someone might be born prematurely, but that prematurity can then lead to a child who's born who needs to spend time in the special care nursery, away from their parent. And so what then happens is there's a disruption of the crucial and normal thing that's meant to happen right from the beginning. And it's a really difficult stage because, and I think that professionals working in the neonatal space are constantly trying to find ways to minimize the impact of this separation from the carer, and especially from mum, because we know there's lots of research that shows that those first few weeks and first few months are so crucial in the formation of that emotional system, or the formation of or the beginnings of the regulation of that emotional system. So that can be quite difficult. Sometimes it's the mum that's sick and that can cause that disruption. Other things include childhood illnesses, so the toddler who gets sick, or the sibling that gets sick, or the parent that gets sick. So, or anything that can disrupt that early development of what we call attachment. And we'll get to that in a minute, because we think that the development of attachment seems to be a really important baseline from which a child's emotional system will grow. Family stress, right, can lead to lots of issues. So sometimes, as good as parents can be, if there's financial stress or marital stress, then those parents, we only have, as adults, we only have so much capacity to contain emotions. And if we have trouble containing our own emotions, we are not going to be as available as we would like to be to our child, who need us to build those networks, right? And again, so we keep going back to that there's the research and the science is telling us that the beginnings of those wires and the fibers that are developing seem to be dependent on those really early relationships. So you're getting a sense here that anything that can disrupt that can really impair or be a difficult factor in that child's emotional development. Now, I want to say from the outset here as well that it's not all doom and gloom, that repair is possible, and that if parents and families can realize that these things are happening and as early as possible can repair that attachment rupture or the breakdown in their relationships, or that repair the stresses, then that is also powerful. In fact, some people posit that having a problem and repairing it might actually lead to a better regulated brain than a brain who's only experienced perfection. Okay, so in some ways, having a stress is actually leads to resilience. And I think most people, who are listening to me would have heard that before, that stress can really lead to resilience unless it gets so high that it can actually push you backwards. Now, there are other factors like child temperament. Okay, so that there are things, there are features of babies, and those who have children know that the children who come from the same parents and maybe even twins seem to have different temperaments, different personalities. Some children are more likely to want to approach others. Others are more protective, and we don't really fully understand that, but there's something about that brain's wiring that's slightly different. And so it is crucial for the parent to kind of know the little nuances of their child, to be able to respond to their child or scaffold or support that child with the experiences that they're having. So again, which raises the problem that if you've got a parent who's stressed, the capacity to go, I wonder if my infant is thinking this or thinking that. I might try this and see what happens, and then if that doesn't work, then we'll do it this way. To be able to do those experiments, you kind of need the space, the safety, the time to be able to do that. But if you're just struggling because you're in a domestically violent relationship and you're just trying to survive, or you're about to lose your home, suddenly you don't have the luxury of time to think and reflect about your child. And that affects this process that we call attunement, right? For a parent to be in tune with their child's being and what they're like and what they need at that time, because that might change at any given moment. So you can then, so now I'm slowly starting to paint a picture here that there aren't necessarily need to be big traumas, right? It doesn't need to be abuse for a child's development to be interrupted. Now, another factor here is that if the parent has experienced early history of trauma or abuse, that in itself can multiply the effect of any other stress or trauma that's going on for that parent at that time, okay? And so if you've got a parent who dissociates or hallucinates every time they get stressed, or needs to use substances to cope, which means then they're less able to be focused and less able to be present, all of that can really multiply the effects of all of these things that we've just talked about. Okay, and then obviously abuse and neglect of the child, and then those who work in child protection out of home care space, the repeated rejections and the repeated separations and loss that these children experience because they go to a foster care placement or an interim care placement, and then they do something that's difficult to manage because they can't control their emotions, and then that carer says, "I can't do this anymore." When you're often rightfully so, because they're doing their best, but it's just the system hasn't prepared them. There's not enough supports around them, and so then that child then says, "Well, you can't live here anymore." Why? Because you're too difficult. So what then does that do to their brain and their belief in themselves and their self-image? I'll leave that to you to work out, but it's pretty obvious that that's not going to be great. Okay. So to sum up that section is that it can be quite scary because lots of things can really impact a child's development, and so we need to be aware of what's happening, right? Because what happens if you have a child, right, who has to deal with it by themselves? Okay, so if you've got a child who has to deal with their life by themselves, because for all those reasons, they don't have the scaffolding or those relationships that would normally regulate, or what we call co-regulate, or help those fibers to grow in their brain, they're going to have to do their best. And what happens? You have an immature brain that at its core has a mammalian fight, flight, freeze response as its primary way of surviving. So that's what happens. Then you end up with a child that's much more protective, okay? That then is less willing to try new things, is less willing to take a risk, right? Unless you've got other children who don't care, and sometimes they can go too far the other way, and actually are reckless, and their impulse control is so poor that they will jump off things without any care for their safety, right? Which again is one of those. It's a way for that brain to kind of overcorrect that protectiveness that the mammalian brain is trying to get them to do. Now, if that part of their brain function, or if that way of brain function continues, what then happens is that children can develop this condition that DDP calls blocked trust. Now, what does that look like? Okay, so children who have blocked trust, what they do is they resist authority and oppose parental influence. Okay, so what's happening here? These are kids who don't trust anyone. That what they will do is they won't let anyone be in charge of their life other than them. Okay, and what our definition of block trust is that these are young kids who, even though the carers or the adults in their lives are trying to help them, they'll block it. Okay, because they don't want to take the chance that this thing that this adult is trying to do is actually going to work out okay. So they resist authority, they oppose parental influence. They won't even take the parent as a potential source of comfort. Yeah, they tend to not be able to relax. They can't enjoy playful moments. They can't be open. They can't share their thoughts or their feelings with others. And they're hypervigilant. They're constantly looking for danger. They're constantly assuming that people are judging them. They're constantly assuming that someone's talking about them or whispering behind their back. And what does all that happen, right? What does all that do? All that does is it takes up so much of their brain energy that they can't learn. They can't be curious. They can't pay attention. Okay, now you can see, remember at the first picture of the brain, that top part of their frontal lobe needs to develop attention, focus, executive functioning skills. So you can see how if you've got these kids who've got lots of these repeated experiences, what will happen is you'll then create this picture that we call ADHD. Right, that they can become hyperactive, and most of the time they become inattentive. The hyperactivity is mostly seen in young boys, and we think that's got to do with the saturation of dopamine receptors in their brain. But that kind of settles down after a certain age. So by about early adolescence, you'll find that most young people who meet criteria for ADHD will have inattention and not hyperactivity, and most adults will have only inattention. Okay, so these kids who don't trust can't learn, and they don't allow the carers to help them and support them. They don't trust the good intentions of their parents or carers. They don't trust that there's unconditional love on offer for them. Right? In fact, what they can do is what they then develop is that, and we don't necessarily do this on purpose, but sometimes what we end up having is we end up sending this message to these kids that if you behave well, this good thing will happen to you. All right. What does that do? It sends a message to the kids that our love for you is conditional on your good behavior. Which is it's not wrong. It's something that we've done for decades and decades, but it doesn't help their development, because what the child needs to develop that emotional regulation is that safety to say, look, I'm going to be accepted, even there's nothing I can do, right, that will cause my parent to let me go, right, to get rid of me. Okay, it's really hard. It's really hard for parents not to be able to send that message. And what I tend to often say is, look, are we going to get rid of them? No, we're not. We always say that. We always say you can't do this. We can't live like that anymore. We can't. But we're here anyway, because most parents care for the kids and are going to stick with it. So why do we say things that make our lives difficult? Why do we say things that make make it difficult for them to trust us? I don't know why we do that. Sometimes it's because the parenting strategies that we've been taught tell us to do that. But I think we need to change, because those things, we're going to stick around anyway, so we might as well do things that actually promote that connection and the belief in them, because we're going to do it anyway. And what happens is, so someone raised a question before about oppositional defiance disorder. I'm going to say on the outside, I don't like the diagnosis of ODD. It's the classic one that highlights the problem with our diagnostic systems, which is the Diagnostic Statistical Manual, which really describes a set of criteria or symptoms or behaviors that then we call a disorder, but then it doesn't really talk about what's going on in the person's brain. But the DSM is a very important tool for us, because all of our treatment research is based around those criteria. But ODD is not particularly helpful, because in many ways it doesn't really describe anything other than the child is opposing me, and looks like they deliberately annoy me and others. And if the diagnosis of ODD was applied, and then we say, why are they doing that? What's happening to their emotional development? What are they experiencing in their world to make them do that? Then the diagnosis can be helpful as a flag to say there's something going on for this child. But often we then kind of stop there, and then it just sort of adds another negative label to the child. And then what happens when we call these things, we call children these labels, and we apply these things to them, what do? They say, well, you don't know me, you don't understand me. So what I'm going to do is, I'm not going to let you have an influence on my life anymore. I'm going to control everything that has to do with me. And so even if you're trying to help me, I'm not going to let you. Okay. So, and that is really, really, really frustrating for carers and parents, because you're trying to help. And, and then, spoiler alert here, we won't have time to go through this today, but what happens is, guess what? We as adults have the same brain systems, hopefully a little bit more developed and a little bit more regulated. And hopefully we haven't had the same adverse childhood experiences that we can regulate ourselves. But our own brain, if we keep getting rejected by the people who help, guess what that's going to do to us? We're going to start blocking too. We're going to start going, oh, I find it really hard to feel for the kid. Like I want to, I love him, he's my son, but God, it's so hard to get that feeling anymore, right? Because I'm walking on eggshells and conflict is happening all the time. And so then if that problem happens, then we're in this really tough scenario, because then really the work needs to be to calm and help that parent to be able to regulate their own brain, because that they're going to be crucial to the treatment plan for the child. Okay. Another helpful way to think about the identity to block trust. All right. So sometimes we talk about this in this way, that say, that you might categorize your children into one or more of these categories. So some of the children, are what we call tigers, right? They're oppositional, they're angry. But guess what? Tigers are wary, right? They're actually wary of you. They might sneak up on you. They're not going to walk around flaunting themselves. They're going to be wary, but then they bite you and attack you when you're not looking, because they think you're a threat. Right? That's one type of child. The second type might be the possum, right? So possum is hidden. You never see them, right? They might be hiding in their room, really quiet, but then you don't know they're in trouble until it's too late. And those of you who have seen angry possums, they can be quite vicious too when they've lost control of themselves. But otherwise, for the most part, they fly under the radar. And these are the ones that we often don't find out that they're having troubles until much later. And the third type, probably the most, one of the most infuriating types, is the chameleon. Right? So these children wear a mask. I'm fine. Right? They'll say yes to you. They've learned how to navigate and manipulate this situation so that there's no threat, there's no demands, and that way, there's no conflict. Right? They don't get told off. But what do? But then they're actually manipulating the situation for their safety, right? That you might find that they are actually still struggling. And then you won't know until later that they've been doing things behind your back, or they've been using substances to cope. Really tough for carers, because you kind of feel really manipulated, and you actually feel like you're being used. Yeah, and there was a comment there about block trust, that showing understanding of the child's experience rather than a negative label, and that is, and we completely agree with that. That's the problem with labels like ODD, oppositional defiance disorder, is that it kind of stops there. There's not even a lot of good research about what treatments occur for ODD, and all the research that does point to treatment goes back to treating the attachment and emotional development, the attachment problems and the emotional development.